previous studies have suggested that there was a better prognosis among women who became pregnant after breast cancer diagnosis. However, for hormone receptor positive patients, there are some reasons for them foregoing the chance to reproduce. On the one hand, at least 5 years endocrine therapy has caused some of them lose fertility. On the other hand, some studies have reported that the patients treated with tamoxifen was less likely to have children in the future than those who did not. And also, no previous studies have been conducted on the safety of temporarily halting endocrine therapy to achieve pregnancy in young breast cancer patients. So based on this, the purpose of our study is to examine the effect of pregnancy on prognosis in young breast cancer patients with HR-positive after surgery and the safety of interrupting endocrine therapy. A total of 1,323 breast cancer patients under the age of 35 were enrolled in our institution from 2016 to 2014. These patients were divided into two groups. The pregnant patients were matched to non-pregnant patients with similar tumor size, lymph node status, molecular subtype, and the years of diagnosis. And at last, 68 pregnant patients and 264 non-pregnant patients were enrolled in our study. And as this slide shows, we did not find any statistically significant difference in DFS or OS between the HR-positive pregnant group and their matched group. 43 patients who became pregnant after surgery received endocrine therapy in our study. We compared if DFS was affected by the time to interrupting endocrine therapy among pregnant patients after surgery. There were 11 patients whose duration of endocrine therapy was less than or equal to 30 months, of whom 2 patients relapsed after surgery. And the other 32 patients received endocrine therapy for more than 30 months after surgery, one of whom recurred. A statistically significant difference was observed for DFS in women whose duration of endocrine therapy was more than or less than 30 months in the pregnant group. Therefore, this study did not observe a worse prognosis in patients with HR-positive who became pregnant after breast cancer surgery and an endocrine therapy interval less than 30 months in pregnant patients led to a worse outcome. Thank you for your listening.